What if one day you and your friends are up at the mall or any other public place, and all of a sudden someone drops to the ground, not responding or not breathing? Would you know what to do? Would you know to call for help, call 911, or would you even know how to start CPR? CPR is such an important thing that everyone should know nowadays, no matter what job field you're in. It's not that hard to learn. It only takes a few minutes if you're willing to learn it. You never know when you could save the life of someone else or when someone else could save your life. So, what I'm going to show you today is how to do basic CPR, compressions, and breathing for an adult patient and an infant. So, what's the number one cause of a person needing CPR? Cardiac arrest. Cardiac arrest is the abrupt loss of heart function in a person who may or may not have been diagnosed with heart disease. It can occur instantly or shortly after symptoms occur. Each year, more than 350,000 emergencies involving cardiac arrest happen. So, cardiac arrest is basically caused when the heart's electrical system malfunctions. So, compare it to the electrical system in your house. If the power goes out, anything that is getting power from your electrical system stops working. So, without that electrical power going to your body, nothing will work. Sudden cardiac arrest, or SCA, is when the heart stops beating completely. Some causes of this include coronary heart disease, physical stress, or some inherited disorders. SCA claims a life every 90 seconds, taking more lives each year than breast cancer, lung cancer, or AIDS. And cardiac arrest can be reversed if CPR is administered immediately. So again, it's so important to at least know the basics. So if you want to know what to look for if someone is in cardiac arrest, these are some symptoms. Palpitations or skipped heartbeats, uneven heartbeats. So if someone is telling you that they feel like their heart is beating irregularly, that could be a symptom. Also, a fluttering sensation in the chest due to an extra or skip beats that occur one right after the other. Another symptom is slow heartbeat, better known as bradycardia. So basically the heart is beating below 60 beats per minute. The opposite of that is tachycardia, which is a rapid heartbeat. So that's going to be more than 100 beats per minute. And lastly, another symptom is syncope, better known as fainting. So if you see any of these symptoms occurring in a person or they're telling you they feel this way, you never know. It could be a sign of cardiac arrest. But at least if you know CPR, you'll be prepared to help that person. So let's go ahead and show you and we'll see if we can save Joe today. So once we're on the scene with the unresponsive patient, we're going to check to see if they're breathing at all. So how we're going to do that is we're going to take the back of our hand and we're going to place it over their mouth and check for any breaths. If there is none, we're going to call for help if we haven't done so already, and then we're going to check for a pulse. Now, to do that on an adult patient, we're going to check the pulse on the carotid artery. So we're going to check right here. If we still don't feel a pulse, then we're going to start compressions. Now, for an adult patient, compressions go 30 to 2. So 30 compressions, then 2 breaths, then continuing on until paramedics arrive. So to do that, we're going to take both our hands, interlock our fingers, and we're going to take the heel of the palm on the bottom and place it in the middle of the chest, kind of in between the breasts, at the bottom of the sternum. We're going to extend our arms, keeping them straight, and we're going to start pushing, like so. So once we've done 30 of these, we're going to apply breaths. So to do that, we're going to pinch the nose, lift the chin, and give a breath. So once you've given the 2 breaths, we'll resume the 30 compressions, and again, keep doing so till emergency medical staff arrive. Now, CPR follows a new standard. It's CAB, compressions, airway, and breathing. So next I'll show you what we'll do for an infant. So our next patient, being an infant, is going to be a little different. We're still going to apply 30 compressions just like with an adult and 2 breaths, except the compressions are not going to be the same way we applied it as to the adult. So if we find an unresponsive infant, again, we're going to check for breath. We're going to do the same thing, place the back of the hand over the mouth. If we don't feel a breath, we're going to go ahead and check for your pulse. So on an infant, we're going to check for the pulse on the inside of the arm on the brachial artery. So I'm going to feel right here. If we don't feel a pulse, we'll start compressions. So compressions for an infant, we're actually only going to use 2 fingers. And we're going to do so in the middle of the chest, as like with an adult. And we're going to push down. Once we've done the 30 compressions, we're going to give 2 breaths. Now, with an infant, because their face is so much smaller, we're actually going to put our mouth not only over their mouth, but their nose as well. Their noses are so small that it's just trying to pinch it like with an adult won't do much. So we're going to tilt their head back, lift their chin, and apply 2 breaths. Once we've done that, we'll again resume the 30 compressions with 2 fingers only, and then the 2 breaths again. So now that you know these basic steps for CPR, would you be ready to do it in case you ran across a situation of an unresponsive patient? Following these simple steps could save a life, or again, possibly save your life. And another thing to know, it's actually not mandatory to do breaths on a patient. For example, you may not want to put your mouth on a stranger. You don't know what they have. You don't know if you may catch something from them. So it's actually not a necessity to do breaths. As long as you keep doing compressions and keep that blood flowing, that's all that you need to do until paramedics can arrive. So remember, check for responsiveness, check for breaths, check for a pulse, and if not, start those compressions. The sooner you start them, the better the chances of that person living. Hope that one day you can use these skills and possibly save someone's life.